Today I wanted to revisit the integumentary system because I do think it is an organ system that takes a lot of abuse and, at least in human society, tends to be undervalued for its functionality compared to its aesthetic presentation. The medical specialty concerning the integumentary system is dermatology. On the more clinical side, we have dermatopathology as well as pediatric dermatology. And on the more surgical side, we have dermatologic oncology concerning cancers of the skin, which can include Mohs surgery as well as micrographic and reconstructive surgery. And reconstructive surgery also overlaps with another subspecialty on the surgical side, which is cosmetic dermatology, and more commonly probably referred to as elective plastic surgery. The skin is the main and largest component of the integumentary system. It is an extensive sensory and protective organ that has a huge capacity for renewal. It allows us to produce vitamin D, to thermoregulate via sweat and control of the cutaneous blood circulation. It allows us to sense touch, pain, and temperature, and it serves as a physical barrier to pathogenic, chemical, and mechanical damage. So it does a lot, and all our other organ systems are internal to the skin, and so it also separates us from our environment. The skin has 3 layers, as I went over in my previous video. The epidermis, which is the superficial-most layer. It has cells such as keratinocytes, melanocytes, Merkel cells, and Langerhans cells. And our hair shafts, the secretions from our sweat and sebaceous glands, and the nails that come out of the distal ends of our digits, these all pop out through the epidermis. The layer beneath the epidermis is the dermis, which consists of the papillary and reticular layers. And the deepest layer of the skin is the hypodermis, also known as the subcutaneous layer. And another topic I wanted to quickly touch upon was how amazing keratin is. This is a protein that makes up quite a bit of the integumentary system. So when you're looking at our bodies, and if you look at another animal, you're really seeing dead cells. And so dead keratinized cells are what protect all of us. And especially in the field of veterinary medicine, there are a lot more accessory structures in the integument. So fur, whiskers, quills, feathers, scales, paw pads, claws, horns, hooves, these are all part of the integument and contain keratin. And when you have an animal patient, it's extremely important to pay attention to the skin and accessory structures. The appearance, texture, color, even the smell and the grooming behavior of the patient can tell you a lot as to their overall condition, whether they have any skin disorders or whether they're facing a different internal disease or issue. So animals can't tell us what their symptoms are or how they're feeling. If we can use examination of the integument as a key to diagnosis prior to going for more invasive or stressful procedures, that can really help our patients. Thank you.